Britain's first baby with 3 parents could be born next year after scientists declared the controversial IVF technique safe for use in women. The fertility technique, which is being pioneered at Newcastle University, aims to allow couples whose children have been blighted by horrific genetic diseases the chance of having a healthy baby by using a second woman's egg. Such a child would effectively have 3 parents, the couple, plus the woman that donated the egg. Now, following more than a decade of experiments on eggs and embryos in the lab, the scientists say they are ready to treat the first women. However, concerns remain about the safety, and the researchers admit that they can't guarantee that every baby will be healthy. The controversy surrounds work aimed at eliminating incurable diseases caused by faulty mitochondria, the tiny sausage-shaped powerhouses inside cells that turn food into energy. These defects cause serious illness in 1 in 6,500 babies and are responsible for 50 genetic diseases, many of which kill in infancy. Women carrying damaged mitochondria can also miscarry repeatedly and often face the heartbreaking choice of whether it would be best to remain childless. To help them, the scientists have developed a technique in which the mother-to-be's diseased mitochondria are swapped with healthy ones from an egg donated by another woman. Successful mitochondrial replacement would allow the couple a healthy child that is genetically their own. Supporters say it will give couples who have endured the heartache of repeatedly miscarrying or bearing much longed-for children the option of having a healthy family. But critics argue that genetically engineering eggs and embryos crosses a crucial ethical line, and claim the first women and babies will be guinea pigs in a dangerous experiment. British law was changed last year, to allow the technique to be used. And now, the Newcastle researchers say they have completed the work needed to show the technique is safe enough to be offered to women. Writing in the journal Nature, they outline how they have grown more 203 parent embryos in the lab until they were up to 6 days old. Tests shows them to be as good quality as conventional IVF embryos and genetically indistinguishable. It wasn't possible to eliminate all the rogue DNA, but levels could be kept low enough for the any babies to still be healthy. However, one experiment raised concerns that the number of diseased mitochondria can multiply over time. This could mean that a baby that appeared healthy became ill later in life. Co-researcher Doug Turnbull said, "The key message is that we have found no evidence the technique is unsafe. Embryos created by this technique have all the characteristics to lead to a pregnancy." He added that any babies conceived in this way could undergo tests in the womb to confirm they are healthy. The fertility watchdog, the Human Fertilization and Embryology Authority, will now decide if the technique is safe enough to be used in IVF treatment. If it gives it the go-ahead, the first baby could be born by the end of next year, with up to 150 women a year benefiting eventually. Professor Turnbull said, "We have to move along respectfully and appropriately, but as scientists and clinicians we are working as hard as possible to make this a reality for our patients." Professor Son Harding, of Imperial College London, said the technique is likely to dramatically cut the odds of a baby developing mitochondrial disease, but not eliminate the risk completely. Dr. Des Kowalik, of King's College London, said, "The Newcastle group has clearly demonstrated that they have taken the highest possible level of precautions and are ready for clinical application." But Dr. Dieter Egli, of the New York Stem Cell Foundation Research Institute, said fears that the diseased mitochondria might multiply mean it is too early to use the technique. Josephine Quintevel, of Campaign Group Comment on Reproductive Ethics, said the only way to show the technique really works will be during dangerous experiments on women and unborn children. Dr. Merita Palsmith, of the charity Muscular Dystrophy UK, said the method could be invaluable for families whose lives have been blighted by the shadow of mitochondrial disease.